Imagine you're working in an emergency room and a patient comes in pale, diaphoretic, and complaining of a 10 out of 10 chest pain. What do? You have to find out if they're having a heart attack as fast as you can. Being able to perform a 12-lead EKG can be the difference between a patient dying of a heart attack or being stable enough to send them to, say, a cath lab where they can have surgery that will save their life. Hi, I'm Tiffany. You're probably wondering, why should I listen to this little spiel about how to do an EKG, right? So I've been an EMT, it's an emergency medical technician, for about 7 years now. I've worked 911 response with Santa Monica Fire, and I've worked in a few different emergency rooms, and currently I'm a trauma tech at a trauma hospital. So I've done a few thousand EKGs in my 7 years. I think that it's a very important skill to have if you are working in the medical field in any capacity. Being able to perform them will save people's lives. I've seen it done a few times every week. So the reasons to listen to this speech would be to learn how to know the important materials for performing an EKG, the things you need. It's not very many things. Of course, you do need the actual monitor. So being in the medical field, it's usually pretty accessible. Another is knowing how to do the actual EKG, where to place the leads, where to place the electrodes, how to position the patient. There are a few different ways to do it, a basic EKG, but I'm just going to show you the most basic, with the patient flat on their back and not moving. And also how to identify if there's too much artifact, if your EKG is going to be usable to identify a heart attack. This is an EKG machine. It consists of electrodes, connecting wires, an amplifier, and a storage and transmission device. The electrodes or leads used in an EKG machine can be divided into two types, the bipolar and unipolar. The bipolar leads are used to record the voltage differential between the wrist and the legs. An electrocardiogram records the electrical signals from your heart to check for different heart conditions. Electrodes are placed on your chest to record your heart's electrical signals, which cause your heart to beat. The signals are shown as waves on the attached monitor or the printout. The importance of getting an EKG done in a timely manner when symptoms are present is very important, because it can mean the difference between a person having many deficits from a heart attack or having little to none. Once you understand why the EKG is important, next thing you need to know is how to perform one. To know that, you need to know what you need. The electrodes are stickers that are placed on the patient's belly or chest and limb leads. Next will be the actual leads that you attach to those electrodes.
Go. Okay, so first we're going to do electrode placement. So first one will go on one of the limbs. For our demonstration, it's just going to go on his shirt, so we don't have to take up your shirt. So we'll put one there. We'll pretend like this is skin. It has to be skin to skin. I mean skin to sticker. So we'll go to the right of the sternum, the left, and then we'll go down to the 4th intercostal space, and then we'll just follow it along, come down to the 5th with this is going to be lead 4, and this is 5, and then 6 will be just on the side. Okay, so once that's all set up, we're going to get our leads here. Place this somewhere on the patient if they can tolerate. And for our leads, So we have our limb leads, so this is for the left, and it's always the left of the patient. So we're gonna go left limb there, left there, and then these are gonna be 4, 5, and 6. So 6 will always be on the side here, 5 will be here, 4 will be here, and these are gonna be the right limb leads. So that one, that one. This is number 3 here, number 1 here, and number 2. So this is always white, this is always green, this is red, and this is always black, and your limb leads will always have the colors. So the way that most people remember it is white clouds over green grass and smoke over fire. So once all of that is set up and you have the patient lay as still as possible, well, this is blinking red, but it's because it's not on the skin. But as long as they stay as still as possible, your EKG will read clear reading with no artifact. And once you see all the leads come up, then you'll hit EKG and it'll take a screenshot, and you just hit accept and it'll print one out. And that's how you attach and print out an EKG.
EKG artifact is defined as electrocardiographic alterations that aren't actually related to cardiac electrical activity, meaning it's not cardiac activity coming from your heart, because it is a muscle. As a result of artifact, the components of the EKG, such as baseline waves, can get distorted. Motion artifact is because the patient is moving or shaking, and it shows more of the rhythmic movement they're making on their actual EKG. I think the scariest part of performing an EKG correctly or not performing an EKG correctly is that sometimes patients don't have any symptoms of a heart attack. Sometimes they come in and they're just having a little jaw pain, maybe having a little neck pain, a little back pain, and you don't think, oh, this person's having a heart attack. So with that being said, it's extremely important to be able to identify a heart attack by correctly performing an EKG, because it will save lives. Takes a few seconds, and being able to do it can mean the difference between a patient leaving the hospital after they've recovered and after some heart surgery in the cath lab, a little bit of time in the cardiac ICU, or them leaving in a body bag because they died from an MI that was not identified. And I've seen that happen a few times, and it's something that can be prevented.